My name is Roger Owen. I'm a consultant haematologist based in Leeds. It's estimated that up to a third of patients with Waldenstrom's macroglobulinemia are asymptomatic at presentation and do not require immediate therapy. This is a somewhat neglected cohort of patients, and we do appreciate that clinical experience in many instances is suboptimal. Indeed, this is the commonest reason for referral for second opinion in my clinical practice, and these patients represent a significant proportion of those who are contacting WMUK for information. With that in mind, we have developed this video resource for patients, carers and healthcare professionals.
Diane, apprehensive, anxious wait for this consultation with Dr. Owen.
Definitely. I'm just wondering what he's going to say, really.
Yeah.
Yeah.
I think in terms of the coming conversation, really important that you brought Miriam with you. Extra pair of ears, definitely helpful.
Yes.
Under these circumstances. It's really quite hard to concentrate on the conversation and not miss things.
Yeah.
And equally, good idea to have the pen and paper to write stuff down to check later.
Mm-hmm.
During the consultation, I'm sure Dr. Owen will make a big effort to be clear and not to use technical language, but he's not so important that you can't stop and ask him for an explanation if you don't understand what he's saying.
Well, he was really nice last time, and I did forget things, I'm sure I did, but luckily, as you say, Miriam's here.
I mean, going into the consultation, you can write questions down on a piece of paper to take in with you.
Oh, that's a good idea.
And then at the end, he will dictate a letter to your GP of his account of the consultation, and it's perfectly okay for you to ask for a copy of that to be sent to you.
Oh, right, I'll
And
do
then
that.
that will appear in the post, and you'll have it there. His account of the consultation in writing for you to go over at your leisure and look things up if necessary and check things out.
Right. Oh,
So,
thank you. That's helpful.
I hope it all goes well for you. He's a very experienced doctor. I'm sure he's going to be very careful and clear with you.
Oh, right, good. That's good to know.
If you recall, when you were here before, we mentioned that we'd found this abnormal protein in the blood, the paraprotein.
Yes.
And that led us down the path of doing all these extra tests.
Yes.
The bone marrow test, the extra bloods and the CT scan. And one of the things that we were worried about was whether this paraprotein was a sign of an underlying lymphoma.
That's right, that's what you said, yeah.
So, so lymphoma being one of the blood-based cancers, and that's why we look at the bone marrow in order to make the diagnosis. So we've had a look at your bone marrow, and that has in fact confirmed a diagnosis of lymphoma.
Is it? Right. So it's like a cancer.
Yes, so we've got to remember that cancers come in many forms. And so this is a cancer that's confined to the bone marrow. We know that from your CT scan. We can't find the evidence of the lymphoma anywhere else, which is a good thing.
Is it like all over in the bone marrow then?
Well, it's present throughout the bone marrow, yes, but it's not. We can't.
I don't even know how it works. Bone marrow. I don't know. Yeah. Does it move? What does it do? I don't know.
Yeah. So your bone marrow is the organ in your body that makes your blood cells.
Oh right.
Okay. And your lymphoma cells have produced this abnormal protein, which we call the paraprotein. It's a specific type of paraprotein called an IgM paraprotein. And that allows us to make a definite diagnosis. So there are many different forms of lymphoma, and you've got a type of lymphoma that's got a very long name. and that's called Waldenstrom's macroglobulinemia. So we would,
But you can't spell that.
No, I don't.
so we tend to abbreviate things in medicine, so just call it WM. I think it would be,
WM.
the sensible thing
Okay.
to do.
Right.
Okay.
Sounds really big, doesn't it?
Yes, I think this is a significant diagnosis, so we need to think about what we do going forward. Now, for many of the lymphomas and the diseases we treat, we don't necessarily have to instigate treatment straight away. There can be situations where we take an active monitoring approach, so just watch things, check your bloods regularly.
Oh
And
no,
this
I
is-
want you to do something.
Yeah, so that's a very common reaction for patients in this situation.
I want to get rid of it.
Well, yes.
We wouldn't be looking at doing that in your current situation. Let me just backtrack slightly. So what we need to work out is whether the lymphoma is causing you any harm at the moment. Is it detrimental to you? So this type of lymphoma has a range of different effects where we would be concerned, and where that would lead us to be thinking about treatment. And what we've got to remember is that chemotherapy treatment is the treatment of choice here, first off. So we need good indications before we start treatment. So the things that we would be looking for would be typically anemia, and you're not particularly anemic.
Oh, I thought I was.
Yeah, the GP
The
said.
GP said.
Yeah, it's pretty mild actually, and it
Is
wouldn't.
it?
Yeah, I don't think that in and of itself would be a reason for us to treat you.
That's why I thought, that's why I was getting tired, because I was anemic. So
Yeah, I think fatigue is a complex symptom, and there is never one answer to fatigue. It's a multi-factorial thing in a sense. You're a busy woman. You have your own business. The stresses and strains associated with that are as likely to be contributing to this as your disease. And there are other indications that would lead us on to treatment. So having very thick blood, for instance, that's something called hyperviscosity, would lead us definitely to treatment. We know that's not the case for you. The protein level in the blood is not high enough to cause viscosity, and you don't have any other things that we're concerned with, and in particular we're thinking about lymph gland enlargement or splenic enlargement where the disease is outside of the bone marrow.
so it's all in the bone marrow.
WM is typically a disease of the bone marrow. So for most patients we would see anemia as being the main reason for instigating treatment.
But you're not going to do anything, you just said.
No, I don't.
No, he hasn't said definitely, have you?
No, well, I personally would prefer to take an observant approach here. We should now embark on a period of active monitoring. Because we can measure the paraprotein, because we can measure your blood count and the anemia level, we can get an idea over time how your disease is progressing.
But what's the downside if I don't have it?
I think there are no downsides to not having treatment at the moment.
Oh.
So,
I can't get my head around that.
You're waiting for it to get worse, is it?
There's a degree of uncertainty now. We don't know how things are going to progress for you. We don't know whether it's going to do so slowly or whether it's going to do so more quickly. The typical disease course for most patients is one of slow change. And we'd want to be checking you regularly, every 3 months or so.
But what if a change? That 3 months sounds a long time to me.
We wouldn't expect too much of a change over that time period, to be fair. The chances are you've had this for quite some time and you've not known about it.
I mean, how are you going to monitor that? How are you going to, you said monitoring, how do you do that?
Yeah, so The routine blood tests that we do allow us to monitor that adequately. So we'd be looking at doing your blood count to check the hemoglobin or the anemia. We'd be checking your kidney function and your liver function and your routine blood chemistry on a regular basis. We'd be checking the thickness or the viscosity of your blood.
All that you mentioned before.
Yeah. And we'd also be measuring the paraprotein. So the paraprotein is an abnormal protein, and that can be measured. So over time, we can see what happens to that protein over time. As people progress, we can see the paraprotein increasing in level. So this is not going to get better by itself. What we don't know is what the rate of change is going to be over time. People in your situation, it's estimated that maybe around about 50% of patients will need treatment in 5 years. So we could be sat here in 5 years' time and you've not had any treatment.
Wow.
But every 3 months in the 5 years you're taking the blood tests and stuff, is it?
Yes.
Okay.
And that allows us to build up, we'll be plotting to see what happens to that paraprotein. This is not a curable disease. This is one in which we look to control the disease during periods where we believe there is disease activity and detriment to the patient. So over time, if you develop worsening anemia or the paraprotein increases and you develop issues with viscosity, then we would be looking at some chemotherapy treatment.
Right.
We'd be doing so with positive intent. We'd be expecting you to respond. The chemotherapy is typically pretty effective, but obviously carries with it the downsides in terms of the side effects and the infection risks that are associated with that. So in a sense, at the moment, we're in a position that maybe the treatment's actually worse than the disease at the moment, because the disease is not causing you any real detrimental effects. If you don't really need treatment, you're still better off without it, because the simple rule here is that no drugs mean no side effects.
But you are doing something that are going to be seen every 3 months, I guess.
Yeah, so I don't think you should see this as doing nothing. I think you should see this as we are monitoring things pretty closely. Okay then.
Okay.
We'll see you in 3 months.
Okay,
Yes,
lovely.
thank you very much for explaining that and taking the
Okay.
time. Thank you.
Thank you very much, Diane, for coming to speak to me. I know you've had a long day already. I just want a few more minutes of your time, if that's all right.
Yes.
And you've brought Miriam.
Miriam, yes.
She's my friend.
Friend.
Yeah.
Okay, nice to meet you both.
And you.
So I'm going to be your key worker. So it's important for you. I'm going to give you all my phone numbers. So it's important for you to know that I'm here if you need me. My job is to be your point of contact and to really signpost you onto services that we think might be able to help you if you want help from us.
All right.
Okay.
Right. Yes.
So this bit really is about sort of the preparation before treatment,
Right.
if and when you need it, and hopefully that will be quite a long time away. And this part now really is the bit where we want you to be sort of active in preparing yourself for treatment.
Oh, right.
So it may be years away,
Yes.
even further than that. But in a way, we want you to be conscious now that you could, whatever happens now will affect
He
later.
said, like, you know, because we were talking about what I could do.
Yes.
And he said, you know, just keep as fit as you can, because that will help
Yeah.
when.
And the
If it
exercise
comes.
and the diet.
Absolutely. Yeah, so I would say that's absolutely true. So really, our treatments, you do need to be fit enough to tolerate. So in a way, you want to get yourself in a good position so
Yes.
that we can offer you everything that we've got. And that's sort of, especially sort of heart health, keeping active. So are you active
Yes,
already?
do you know what I do? I do over 55s ballet.
Oh, fantastic.
Yeah.
Okay,
Yeah.
yeah.
Love
The
it.
show was lovely.
Yeah, okay, so your balance will be good as well then.
Oh, it is, yeah.
Yeah.
Well, it's very good for balance. Yeah.
Yeah, okay,
love it.
fantastic.
I mean, I'm not a ballerina by any means, you know.
You're a trier.
I'm a trier.
Okay, and what about sort of any sort of walking or?
Yeah, I do a lot of walking and the
Brilliant.
dog and stuff. So yeah.
Okay, fantastic. So definitely keep that up.
Yeah. Right.
Don't let that fall.
Okay.
We want you to be really fit and heart healthy. So, you know, maybe take some hills in your walks, that type of thing.
Right.
You know, always have a view now to what you're going to be like in the future. So as long as you keep
Do a
being
bit
active.
more.
Yeah, so I would
Right.
say yes, yeah.
Because
Yeah.
I do tend to stay away from hills if I can. So
Yeah. Oh
I
no, see
won't.
them as a positive thing.
Okay.
Definitely. You're strengthening that heart as
Okay.
you're going up that hill.
Yeah.
And really that goes for, you know, what you're eating and drinking as well. So,
Yeah.
you know, I'd say everything in moderation. You don't have to be completely sort of teetotal and,
Right.
you know, fat free. But again, we just want you to be healthy.
Well, do you have any sort of, I don't know,
Oh, go on.
you know, brochures or anything on what I shouldn't eat, maybe?
Yeah, so I'd say there's nothing you shouldn't eat at the moment. If you were on treatment, we have some information about foods to avoid because of infection and things like that. But at the moment, really, you've just always got to think in your mind sort of heart health. So nothing
Right.
too fatty, nothing too sugary,
Right.
but you can treat yourself every now and again as long as everything's in moderation.
Okay. Okay.
Another thing you need to do really is look after your immune system. So, you know, this disease is part of your immune system. So your immune system probably won't be working at that sort of 100% level. So you've got a good immune system, but you've also got some of these rubbish cells that don't do what they're supposed to do.
All right. We
So-
didn't really talk about that, did
No,
we?
we didn't say that.
So how do I look after my immune system?
So we definitely recommend you get all your vaccines done.
All right.
So COVID,
and
flu,
stuff.
Oh,
yeah.
I wasn't going
Yeah.
to do that this year.
Oh
No,
no,
you've
definitely
got
get
to.
that done because that's the best protection for you. You don't want to put your immune system under repeated infections under all that pressure.
Right.
Shingles vaccination as well. That'll be another one for the list.
Oh, I didn't know.
Shingles.
So I
Yeah.
would say there's a lot of things you can be doing and a lot of information to take in.
What about the flu jab?
So you're definitely the flu jab as well. Yeah.
They
Once a
always
year.
want to give you that pneumonia one, don't they? When you get the flu one.
Yeah, so we want you to have the pneumonia one
Oh,
as well.
Like
So
a pincushion.
yeah.
Yeah.
So we will take you through this every time you come to see
Right.
us, and I will signpost you to the WMUK charity, who also have some information and sort of like a checklist for things that you can make sure that you're getting done while you're on the sort of active monitoring.
It's a charity.
Yes,
Oh.
yeah.
Oh,
WMUK is a really good charity. Lots of information about WM itself because it is a very rare type of lymphoma. So they give you really detailed information. They've really been working on active monitoring as well. So
Right.
there's a lot of information about being on
Oh,
active
right.
monitoring and the purpose of it
Right. that'd
and
be
what you
good.
can do to make it a little bit more active than it perhaps used to be.
Right. Right. Oh, thank
okay.
you.
So how do we get onto the website then?
So I'll be giving you a booklet about WMUK. So
Yeah.
so all the information about how to get onto the website. They've got a patient support line. They
that's
have a
good,
lot
isn't
of
it?
involvement for people that do have Waldenstrom's themselves. So if you wanted to meet somebody else, they'll have annual conference, that type of thing as well.
Wow.
Really useful resource for you to know
So
about.
can I
And-
have that?
yeah, absolutely, definitely. I've got a few other things for you to take away as well.
Right.
So I'd say
Brilliant.
initially, we always like to see you every 3 months. So a little bit more regularly to begin with, to
Yes.
see what's happening with your proteins and to really fill you in with sort of all this information, answer all your questions, because at the start, there's quite a lot to learn.
Yeah.
If you're comfortable and your proteins are staying very stable, we can stretch that. There's a couple of schemes that some places might run. We run patient-initiated follow-up that you can sort of go on that if you don't want to come in on for regular appointments.
Oh, I'm happy to come in.
Okay.
I'm just wondering, is that, does it happen definitely every 3 months? That's all.
So definitely every 3 months to begin with, just while you're getting to know
Yeah.
us and we're getting to know you.
Yes.
And then we'll definitely have a bit of leeway after that. You know, hopefully we won't need to treat you for a good few years, but what we want to do is make sure that we know what your pattern of proteins are doing and really give you the heads up. I'd say in this game, nothing is really fast. So if we can see a few things moving, things becoming a bit more active, we'd want to see you a little bit more often so that we can start talking about treatments.
Yes.
And just really be there for you, really, if you need us.
Yes, the doctor said that Diane could contact you in any time within the 3 months. I think you said that at the beginning.
Yeah. So I'd say really that's the most important message I want to give you, really, is that, you know, I am your key contact. There's a team of us, and really we want you to contact us when you need us.
Yes.
You know, not only those 3 monthly appointments, in a way, they're our regular set ones, but in between, if you need us, if you're worried about anything, if you think symptoms are getting worse.
Well, how will I know which symptoms they are? Because I know the fatigue, the doctor mentioned fatigue, but I'm just thinking, I might have other symptoms that's nothing to do with this.
Yes. So I'd say there are certain red flag symptoms that you need to know about. So the fatigue you already know about, and that will be because you're getting a bit more anemic, you get more tired, a bit short of breath when you're trying to do things.
Yes.
The other one is weight loss. So we definitely want you to give us a ring if you're losing weight and you can't really explain why. You know, you're eating as normal, but you're still losing a bit of weight. And then you might have some sort of viscosity symptoms, which is when your blood gets a bit thick. So
You mentioned that,
He
didn't
said about that,
I got a
yes.
bit lost.
yes,
What does that mean?
So it just means that your blood's a little bit thick as it's moving around. So for
Yes,
you, it'll mean that you might get headaches, or you might notice some bleeding, like nosebleeds or bleeding around your gums, that type of thing.
Nosebleeds?
Yes, yeah. So these are definite red flag symptoms that I would want you to call me about.
Right.
If you have any other symptoms and you're not quite sure, I really don't mind you phoning me either, because, you know, I can easily give you a bit of advice and say,
Yes.
that won't be anything related, go to your GP, or I
Yes.
might say come in and see us a bit earlier. So the most important thing really is that you know you can contact me, and that we're here really to be your point of
That's
contact.
reassuring.
Really good,
It's
isn't it?
really good.
Yes.
Yeah, because
Yeah.
I don't know what to expect really. Well, I do know what to expect. I know I'm going to be fatigued still, but I'll look out for those things.
Yeah, and they do say, you know, for fatigue, the only thing you can really do to combat that is be more active. So definitely,
really?
absolutely, yes, yeah.
No,
The less
I
you
got
do,
the
the
opposite.
the less you do, the more fatigued you get.
Oh, here's me
So-
thinking I'll be having a bit of a lie down on myself.
Yeah.
No, we
Exactly.
definitely want you to try and be a bit more active, get that heart healthy, and, you know, just look after yourself for, you know, for when that point comes, if you do need treatment, so that we can
okay.
offer you everything
Yes,
that
to
we've
get
got.
stronger.
Absolutely. Yeah.
All right,
Yeah.
okay, I've got that. Thank you.
Okay.
Yeah. Yes. Was there any? You mentioned there was other things you had to.
Yes,
do
So I've just
yourself?
got a few other things. So that's definitely my contact number.
Oh,
That's the key
lovely.
worker booklet for the department. And I'll just give you a few other bits of information about some other services that are available. But we will go through this in time. We'll sit down with you and, you know, have a sort of an assessment to see if there's anything that's out there that you'll need, or, you know, that might help support you over this time.
Okay.
We don't have to go through all that now, though.
Oh, absolutely not. No,
I don't think I
definitely
could
not.
take on
No,
that
it's
more,
been a
really.
lot.
I bet. But I definitely say to contact, you know, WM, have a look at that website. You know, if you do anything after today, definitely
Oh,
do
my
that to
daughter
get
will
your
be on it like
information.
that, won't she?
Yes,
To
you
be
will.
honest.
Good.
Yeah.
Yeah. And if your daughter has any questions, she can give me a ring as well. You know, we're more than happy
Oh, you
to.
shouldn't say that. She'll be on every day.
Yeah.
Well, that she can also contact WM UK as well. So
Yeah.
they have a patient support line there, so she can do that as well if she doesn't want to come to us. So
Yeah. Very nice, isn't
Yeah.
it? You know, yeah. Very good.
yeah, I say just make sure that you know that we're always here if you
Yes.
need us.
Yes.
Okay,
Okay.
and then we'll just over time get to know each other. We'll get to see what's happening with your WM,
Yes.
and any questions you just bring
Right.
back to us.
Andrea, thank you so much for coming and speaking with me today. I was wondering if you wouldn't mind just introducing yourself, giving us a bit of background about your history with WM.
My name's Andrea Woodford, and I was diagnosed with WM in November 2018. It was a random blood test for something else that I'd gone to see the doctor about, and it come up with some different things that they weren't too sure about, so I had further blood tests. And it came from there that I went to see the doctor at the hospital, and then went for a bone marrow biopsy, and that's when they confirmed that I had Waldenstrom's macroglobin anemia. I had 2 years, I would say, 2 years and a little bit, until I needed treatment. Mm-hmm. So treatment was in 2020, just before COVID. Yeah. So in that February, and so I started initially with treatment. I had BNR, so rituximab and bendamustine. Yeah. So I was due to have 6 treatments, initially 2 sort of consecutive days, but then because of COVID, they decided I'd only have 1 day. They didn't want me in the hospital too many times, just the danger of coming across somebody that maybe had COVID. So that's when I had it. And since then, that was June 2020, then that finished. And 3 years now, I've been really well. My paraprotein levels are sort of non-quantitative, so there isn't any trace at the moment of WM.
Amazing. So obviously you had your treatment, but before that you said you had 2 years where you had no treatment, so you're on active monitoring. And then I assume obviously you finished your treatment back in 2020, and now you're back on active monitoring and have been for around about 3 years. So you've experienced active monitoring for around 5 years, is that correct?
Yes, yeah.
And obviously when you were first diagnosed and went on active monitoring, how did the consultant sort of approach that conversation with you about active monitoring?
At the time when I was first diagnosed, I was in a bit of a way, really. I found it was all rather overwhelming, and it was sort of quite a quick conversation, and that he told me I wouldn't need treatment, but I don't think he actually used the words active monitoring. But then I went and saw the clinical nurse specialist, and she explained about it a lot more, and then I understood that I would be seeing him on a regular basis, and then we talked that through, really. Yeah.
And how did you initially feel when you said that you weren't necessarily going to have treatment straight away, instead they were going to place you on active monitoring? How did that kind of make you feel at that time?
I had mixed emotions, because I was like, oh, thank goodness I haven't got to have a chemotherapy or any other treatment at that time. But then on the other hand, you're just thinking, is the cancer going to get worse? And when would I need treatment, or would it be too late? Because I think you think of cancer as being a solid tumour, whereas blood cancer is very different, and it's treated very differently. Because usually you think, just cut it out and I'll have treatment and everything will be fine. Whereas with WM, you're living with cancer, it's not going to go away. So it's understanding that, really.
Okay. And obviously, like we've mentioned, you experienced active monitoring before your treatment and then after. Do you think that you feel differently about active monitoring before and after treatment, or do you think it's quite similar?
I think it's different, because when I first started there wasn't COVID, so I used to go into clinic, used to see him regularly, see my nurse specialist, and then following COVID, and during that time, that active monitoring was via the telephone. And I was asked, do you want to go? You can come back to clinic if you want to, or we can carry on having telephone conversations. So I decided to have telephone conversations. But sometimes I think you lose something because you're not actually seeing that person and they're not seeing how you are physically, sort of mentally. Yeah. I think it's a quicker transaction, if you know what I mean.
Yeah.
You know that he's very busy, and I do get ready, you know, have questions and things like that. But it's just taking the time. I think there's less time taken. But also, I'm feeling well, so that's different again to what it was, you know, before treatment. Yeah.
And obviously, you touched upon that, they assessing you and how you're doing mentally as well. Obviously, we understand that active monitoring can have quite an impact on your mental health. How do you feel kind of emotionally around being on active monitoring and dealing with that pathway?
It's fine normally, but when you know an appointment's coming up about a week before, you start to get apprehensive and a bit anxious because you're always thinking, well, maybe this time they're going to say that the bloods are showing that WM is sort of coming back with gusto and that you might need treatment. So you do worry. And on that day, when you're, you know, when I talk to him, you get quite tired really by the end of that day because you're so anxious about it and you want things to go well. But by the time you've had that conversation, it's like, oh, thank God, you know, that you're okay. It's that relief really. But it's that build up is quite difficult.
Do you find that the management of your appointments and the expectations of your appointments get better as time goes on, or do you feel like it's still quite similar to when you were first diagnosed? You know, sort of understanding in terms of why they're treating you in this way, or not treating you, actively monitoring and sort of going down that route?
I think it's over time, because I, you know, have made use of WM UK, my knowledge has improved, and talking to different people with WM also has made a difference. So actually the questions I'm asking are more informed. So it is a different process in that way, because initially you're just like, you know, a rabbit in headlights really. You don't know quite what to ask or how to ask it. But over time it has got easier. I still prepare, I still have questions, I write everything down. And I, you know, and as he's talking to me, I'll write little notes as well so that I can look back and look, you know, and see later on. And when I'm talking to other people, I know what I can refer to. I just think you feel, because you have greater knowledge, you feel in greater control when you're having that active monitoring. Yeah.
And obviously you touched upon a few complications in terms of when COVID hit and how that changed your active monitoring. Have you had any other sort of complications or any challenges around active monitoring?
I think it is just that time. That's the thing that I find most challenging. You know, we all know in the NHS doctors are busy, so I don't want to take up more time, but there are things I want to ask. So sometimes, because he knows I'm well, he wants to get on. It's not, you know, there's no fault in that, but it's just actually, no, can I bring you back? So that's the challenges I have. But my clinical nurse specialist is always available. If I ring her up on, you know, the same day, she'll go back to me. So I know that support network is there, and it's a really good support network for me.
Amazing. And if you could give sort of one piece of advice to other patients around active monitoring, is there anything that kind of comes to mind for you?
It's really easy to say don't worry, but try not to worry, and just be prepared, get all the information you can, so that when you have information, when you have an appointment, you can ask the right questions. But yeah, they're there for you. You know, it's really important that they understand that people are there for you all the time. There's always somebody you can talk to, whether it's somebody from the WM UK group or you've, you know, made friends with somebody that you can contact, but your nurse specialist is always there. And if they don't know the answer, they'll ask, well, in my case, if they don't know the answer, they'll ask a consultant and they'll get back to you.
And Andrea, if you could give healthcare professionals one piece of advice around active monitoring, what do you think that would be?
That would be to be really active in their listening. I think that's key. You know, to really listen to their patients and what is it that's troubling them, because sometimes the questions you ask, it might be other things that are underlying that. So it's really getting to the bottom of those symptoms that a patient may have.
Brilliant. And whilst Whilst you're still on active monitoring, do you feel that you're still quite well supported? You know, obviously you've had treatment before and you're very much supported through that. Do you still feel supported on active monitoring?
Yes, definitely. Yeah, I think that team, as I said, it's that network of people that you can count on. Yeah. So even though I think like I said, that you feel like appointments are shorter in the fact that you are well, and obviously you've got less probably questions you want to ask, and he's got less to tell you. That they are there at all times.
Amazing. Thank you so much, Andrea. I really appreciate that.
Thank you.
Tim, thank you so much for joining me today. I really appreciate it. I was wondering if you could just start by introducing yourself and giving us a bit of a background of your Waldenstrom's diagnosis.
So my name's Tim Ferris. I have to have a company medical every year, and this started for me when one of these medicals came back with some blood tests which looked a little bit odd to the GP, and she said, you really need to go and get this checked out. So I went off and had various other tests, and eventually it came back as Waldenstrom's, which was something I'd never heard of before and didn't know quite what it was all about. But obviously the consultant explained it to me, and I was able to do a little bit of reading up on it as well.
Amazing. And when was it that you were diagnosed?
So I think it was about 2.5 years ago now.
2.5 years ago. And have you needed any treatment since your diagnosis?
No, I haven't. I've been on active monitoring since that diagnosis.
Okay. And how did your consultant approach that conversation around active monitoring with you when you were diagnosed?
He was at pains to explain that it's a very slow developing condition, and that it could be many, many years before I need any treatment, but they do obviously need to keep track of how it's developing and assess progress. So it was explained that I would just come back for blood tests every 3 or 4 months, and literally keep an eye on it.
And how did you feel when they first sort of told you that they weren't necessarily going to treat this cancer, they were going to pop you on active monitoring?
It kind of runs counter to your expectations, because I think that the kind of the cliche is that they say, oh, we've caught it early, so we're going to do something about it and get rid of it, and that's all going to be fine. So it's quite different to that. And I'd never heard of this kind of thing before, of having no treatment but just active monitoring. So it was a little bit unexpected, I guess. I mean, the whole thing was unexpected, but the consultant's plan to just monitor it was also unusual. But I mean, personally, I was quite happy in the sense I didn't really want to have any treatment. Yeah. So it was nice to be able to postpone.
And so obviously that was 2.5 years ago now. Mm-hmm. How do you feel sort of emotionally about active monitoring now, or how do you feel like you cope with being on active monitoring now?
I think it's something that you can just park to a large extent for most of the time. When it comes up to the point of your next blood test are due, it will be on your mind a little bit, and you kind of want to just I guess be prepared for whatever the consultant might say to you. So it does just loom a little bit larger at that point.
Yeah. And you said that you want to be prepared. How do you kind of prepare yourself for those appointments? Is there anything specific that you do?
I don't think there is anything useful you can do, to be honest, but it just inevitably is going to be on your mind a little bit more.
Yeah, absolutely. And have you sort of had any challenges with your active monitoring over the years, or do you feel like it's been quite a sort of well-structured pathway?
I mean, I think it's been reasonably well-structured. I guess the thing that does happen sometimes is you get the blood test back. There may be dozens of different kind of bits of data in that, and sometimes something will be a little bit out of the usual range, and that sort of can plant a question in your mind. Mm-hmm. But I think the the thing you have to do then is just ask about it and have a conversation with your consultant and see what it is that they think about it.
And do you feel quite well supported whilst you're on active monitoring? Obviously, a lot of people talk about treatment and how they're well supported throughout treatment. Do you still feel like you're quite well supported on active monitoring?
Yeah, and I think the support is there if you want it, and I don't make use of all of the resources that are available, but I know they're there, and I think that's important.
Amazing. And if you could give one piece of advice to other patients about active monitoring, so whether that be how to manage it, how to prepare for it, what kind of advice would you give?
Well, probably a couple of things. One, I think when you get this kind of diagnosis, I think it's important to have somewhere you can go and find stuff out for yourself, if that's the sort of thing you like to do, which I do. So the WMUK website is really important for that, for me. And the other thing is just going back to something I said earlier, which is if there is something that comes up which you don't understand or is a bit unexpected, then just ask, and your consultant will answer it as best they can.
And then alternatively, if you had some advice that you could give to healthcare professionals about how they can improve supporting their patients on active monitoring, is there anything that you can think of?
For me, I think just I'm always somebody who likes more information and data rather than less, so I'm always happy to have the full picture.
Amazing. Is there anything else that you'd like to say about your active monitoring experience?
I don't think there is. I think that's it for me.
Amazing. Thank you so much, Tim. I really appreciate that.
Thank you.